Hi, I'm Janice Pastorek. A lot of you know me that are watching this because you're my patient or you're one of Dr. Pastorek's patients. I'm a nurse. I work in aesthetic medicine. My husband's a facial plastic surgeon in New York. Right now I'm home in Connecticut. Luckily we have this wonderful place to take refuge. But we've been watching our emails and listening to your communications, and we thought maybe it would be helpful if I did a little bit of a video just kind of going over some of the protocols we think might be helpful during this stressful time. So again, I'm a nurse, for those of you who don't know me. I'm a Georgetown graduate. My husband is a facial plastic surgeon, and while we do mostly cosmetic things, we do advise in many ways on wellness. I'm also a homeopath, and we've incorporated some of these homeopathic remedies into our protocol because homeopathy through the years has had a much better outcome than what you know as traditional medicine or allopathic medicine. So we listened to 3 grand rounds this week. One from the Harvard Mass General Hospital group, one from Northwell Health, which was, I think it's the biggest consortium of hospitals in New York City, and one from an international interdisciplinary group that incorporated CDC professionals and intensive specialists, along with speaking to our friends on the West Coast at Stanford, in New York City, and in Italy, and in Germany. And so we came up with a list of things to do that some of our patients those last few days that we were in our office were privy to. But I wanted to go over that with you because I think it might give you some comfort, and it also may give you a little protection. We feel it won't hurt, and it may help. So let me just talk about homeopathy one more time. A little bit more. So the reason for the homeopathic remedies is because in every epidemic or pandemic in the last 200 years, including even recent times, homeopathy has had better outcomes. Now, the statistic that comes to mind right now is related to the Spanish flu. So during the Spanish flu, they studied 24,000 people that were doing allopathic medicine. Again, like you know your regular medicine to be. And yes, back then they didn't have antibiotics and a lot of other things. But at that time, 30% died of the Spanish flu that were treated this classic way. And they studied 26,000 who were being treated with homeopathic remedies. And only 1.05% died. And that dramatic difference is evident in all pandemics and epidemics throughout the last 150 or more years. So we spoke with, or we communicated with the most experienced homeopaths and took their advice along with some of the other things that doctors were saying. And so on our list, we have, as our first prophylactic for flu-type syndromes, arsenicum album. So arsenicum album is a homeopathic remedy. We generally think of it for, here it is in the pellet form. We generally think of it for basically food poisoning. I always carry this with me traveling because it's just remarkable if you get a stomach upset due to bad food. And but in this case, we're using it because it's also the remedy for slow evolving respiratory disease. And it also helps with those who have a fear of death. And we just think it's a remedy that is worthy because basically these very experienced homeopaths, as well as the health department in India, announced to their citizens they should be taking this. And I have to say that there was a lot of flack online about them making that recommendation. But if you look even today to see what's going on in India, and yes, they're doing more than just this, But for the 1.3 billion people, they have relatively few COVID cases, even though they're right next to China. And most of those cases that they have came from people that came from outside the country. So our recommendation is the Arsenicum album 30C, 3 to 5 pellets, once a day for 1 week, and then Monday, Wednesday, Friday thereafter, because now it's in our neighborhood. So prior to that, it was a different recommendation in terms of how often to take it. But now that it's in the neighborhood, and it's in all of our neighborhoods, it would be that 1 week daily, and then Monday, Wednesday, Friday thereafter. The second recommendation is for Gelsemium sempervirens 30C. Now, many of our patients will recognize this as something we give patients when they're anxious. And it is an amazing anxiolytic. And it can be taken up to 3 times a day or to initiate sleep. But in this case, this was they call it the genus epidemicus, whereas arsenicum was is considered the COVID genus epidemicus, the choice prophylactic. Back during the Spanish flu, Gelsemium was the genus epidemicus. This works well when there are symptoms of malaise, lethargy. You feel exhausted, you feel achy and painy, and you feel weak, just like you're coming down with something. And you would take it until you felt that wasn't happening anymore. Now, my family and I have used this for having that malaise, that lethargy, that you just feel like something's happening. And we've seen in about 15 minutes, we feel better. Homeopathic remedies work best really once if you take them as soon as you can when you have the symptom. You may see on these blue tubes, like this blue tube, the Gelsemium has on it, relieves stage fright, apprehension, and fever. They're required by law, by the FDA, to list at least one thing that this remedy works for. So this is what's on Gelsemium. On the arsenicum, it says relieves symptoms of food poisoning. But it's not just for food poisoning. We use this for a lot of different things. And that's just one of the things it's good for. Again, slow evolving respiratory conditions is why Arsenicum album was chosen as the prophylactic by the experts. The third homeopathic that's on our list is oscillococcinum. You've probably seen this at Whole Foods, if you've been to Whole Foods at all, or in the health food stores. And in fact, I even have it at our Stop and Shop in Connecticut. And this is the remedy for flu-like symptoms. Now, we've been using this for years for before travel, like before a flight, after a flight, anytime we're exposed to a lot of people where there may be something that we could catch, because it boosts the immune system. In 2018, the Eighth Circuit Court told Boron, who makes this, or awarded Boron, they won the case when they were challenged as to its efficacy. So we know from our own experience that this has been very helpful, and it may be for you. So in terms of a prophylaxis for this particular COVID pandemic, we would say take it once a week. And this is a little different. This comes in, let me just grab a vial. So instead of being pellets, and by the way, so with the blue tubes, you want to hold the cap towards the floor and just twist, which will drop the pellets one by one into the cap, and then you pull the cap off and don't touch it, just put it right into your mouth and then put it back on. It's preferable not to touch them. So pellets are taken by removing that little cap and twisting the cap and then removing it and taking it and putting it back on. But Oslo comes in these little vials. So I'm going to take one out right now. And it's like a whole bunch of little pellets, and you put that right under your tongue and let it melt. All of these taste the same. They're made They're made of a little sugar pellet, like a little lactose pellet. They won't bother a diabetic, and they will not bother anyone even with a lactose intolerance. It's been studied to show that the lactose stays on the palate, doesn't go back into the gut to cause any lactose issues. So if it were an issue for you, if you were really nervous and felt, oh, I can't take the pellets because I'm worried about lactose, and we've never seen anybody have a lactose intolerance effect from this, you could find it in liquid form, but I don't really think it's necessary, or we don't really think it's necessary. So oslo is once a week, or if you're exposed to someone that you think might be not well, or if you've gone someplace where you think that you've had multiple exposures and you're just feeling a little insecure about whether or not you've been exposed to something. The fourth remedy that we think is quite valuable is, and especially this week since we've had a lot of phone calls about anxiety, about worry. In fact, we had one patient who took themselves to the ER 3 times with panic attacks, and it was all anxiety. So typical feeling of anxiety, you might feel like caught in your throat. You might feel like there's a lump in your throat. You might feel your heart racing, or even a little chest pain, or your hands are tingling, or your feet are tingling, and that's because you're probably breathing very shallowly, or you're actually so tight and constricted, you're causing a little cutoff of circulation. Ignatia really helps alleviate that sense of worry. We also use this for grief when people are really sad, and I think that applies to now. So you would take 3 to 5 pellets, again, twisting with the cap aimed towards the ground, twisting until the pellets drop, pulling the cap off, putting it under your tongue with the cap. If family members are using this, I would wipe the cap off with a little alcohol after you've used it so you're not passing germs around, or you each have your own little cap or little tube. As with all remedies that are homeopathic, you take the remedies less often as you feel better. So if you're taking your gelsemium because you're anxious and you're getting some benefit, if you keep taking too much of it, you might actually feel a little anxious. The rule of thumb in homeopathy, as symptoms get better, you take it less often. But that's not going to be necessarily the case with the arsenicum, because we're using it as a prophylactic priming of the body. And you're not really taking it that often. You're just taking it to prevent symptoms. It's not quite the same as when you're taking your Ignatia or your gelsemium. Now, if you're truly having panic attacks and the Ignatia doesn't do it for you and the gelsemium doesn't do it for you, really for panic attacks, our best bet is often aconite. When patients come in to us who've fallen, been in a car accident, had a trauma, aconite, 1 dose, really helps them come centered. Again, on this, it will say on it, relieves high fever of sudden onset with dry skin. Both of the, whether it's a 200C or a 30C, it says the same thing. Aconite is also a remedy for fevers that are high. So not a bad little tool to have in your cabinet, not just for panic, but in case you do get a high fever. It's one of the remedies that we suggest. So if it's 30C you're taking, the 30C you can take less often, or more often, more often if you have a fever or anxiety, and the aconite you would take less often, probably no more than twice a day. So these are available on, I know they're on Amazon. If you're having trouble finding it on the internet, or Bigelow Pharmacy in New York is a big supplier of homeopathic remedies. If you're having trouble, you can email us, and it's possible. I have an account at Boron, and we can drop ship to you. I know they're a little back ordered right now on the arsenicum, but their supply is coming in. Okay, so moving along as to other recommendations, we talk to people about using Bactroban, or the generic name is mupirocin. So when MRSA was a big issue, we had to come up with a protocol that was helping us not have MRSA infections. And chlorhexidine, a surgical scrub, is in 4%, is something we'd have people bathe in, and it does kill viruses, making sure you don't get it in your eyes. And then putting the chlorhexidine up your nose, and then also using mupirocin. Now, for this particular problem with the COVID-19, we're not necessarily saying you need to put the scrub up your nose, but it isn't a bad idea to use mupirocin, even though it's just bactericidal. They've used this, the company hasn't tested it, but they've used it for HPV, which is viral. They've used it for herpes, which is viral with success. And at the very least, it's creating a barrier in the mucous membrane, and it's a sticky barrier that droplets may adhere to. Doesn't mean it won't go all the way in, and we're not certain this is going to be a slam dunk anything, but it's better. It's certainly better than nothing, and it might give you that mental ease that we're all looking for these days, going out, especially to the grocery store, if you don't have a mask. And we are recommending that you do go out with a mask. When you go out, you want to wear a mask, you want to put glasses on, you want to cover your hair, or at the very minimum, pull it back, and you want to wear gloves if you have rubber gloves, and then take them off when you take all that off before you go inside. These are just sensible precautions that maybe are a little bit over the top, but we just think it's better to be a little more conservative, because they're not really sure exactly how it spreads. We know that there are a lot of silent spreaders, and because of that, they can have no symptoms. Somebody in my building who is a doorman just went for one of those drive-up tests without symptoms, and turns out he was positive. And now they've had to clean the entire lobby, and any place he's been, they had to bring in a special team to do that. I think if I were living there at the time, it would have rattled me more. But knowing that for the last several weeks I've been wearing a mask and my glasses and gloves to go even in and out of my elevator has brought a certain level of comfort to me. So if you don't have the mupirocin, the next best thing would be your neosporin or your bacitracin. Again, even Vaseline, creating that little bit of a sticky barrier that things might adhere to before going deeper into the respiratory tract. There's been a lot of talk about zinc lozenges, about zinc being beneficial in this case, because coronaviruses do not like the environment of zinc. And so, for instance, I'm going to just grab something here. We had gotten some elderberry with zinc. So we're thinking, and now there's a little bit of a question whether elderberry, I think if there's any question, just don't do it. But zinc is a good idea, but better than taking zinc alone. We've heard from the professionals, if it has a little bit of copper in the formula to balance, it may prevent some people who, if they just have straight up zinc, might get depression. So Zinczyme is a product that has the zinc and copper. Actizyme is another one. Designs for Health offer a zinc and copper combination. If you want to take a lozenge to sort of protect or wreck any bacteria or virus in your throat without using zinc, there's a company called Silver Biotics that makes these nanoparticle silver lozenges. This one happens to have vitamin C in it, but it was recommended to us that this might be a better alternative than zinc as far as creating that sort of bath of something that's going to denature the virus in your throat And so they have a website called silverbiotics.com. I think that's something, to look at. They also make a silver gel and a silver cream. You can use this on your hands as a, rather than wash, let's just kill the virus without having to wash my hands. You got to put a lot on and really smooth it over. Or just if you're that nervous person that feels like even if they haven't been touching anything, you want to do something. Using something like this may save your hands from getting too chapped. For those of our patients who are familiar with some of our products, the Endor products that we recently introduced, now these are expensive products, not everybody's going to have these, but if you do have this at home, the Endor Anti-Cellulite Cream, which it's award-winning along with their Endor anti-aging serum. Both of these have a nanotechnology of gold, and gold is antimicrobial and virucidal. It's just sort of a little comfort, but these are expensive, so I'm not suggesting you run out and buy that. But we have found here at home that this is really great for chapped hands. Now, that's been one of the big phone calls or emails. People are raw and irritated from washing their hands and using the Purell and wipes. So our suggestion is to use a little 1% hydrocortisone cream. That will sting if you're a little bit rough. Don't overdo it. Do it a couple of times, maybe up to 3 times a day. But maybe even better than that, trying to get a hold of a little Aveeno and eczema therapy. Very effective, very protective, and may just help you recover from some of that irritation. What else can I suggest? We were told that we should elevate, this is by the Grand Rounds people, we should elevate our vitamin D3. They were talking very high numbers, and we don't think that people should take that high dose without getting blood work done. So, maybe up to 5,000 IU daily. And if you're out in the sun in your backyard, if you have one, or on your porch or your terrace if you have one, then you reduce it. You don't take quite as much, but important to increase your levels of D at this time. And you might want to call your internist to ask what he recommends. All of them suggested, at least I believe it was all of them, CoQ10, 400 milligrams for heart health, because this COVID attacks not just the respiratory, but it affects other organs, in particular the heart. So they suggested to us that we up our CoQ10 intake to 400. Everyone said, or most said, we should increase our vitamin C intake. And at one point, one group recommended 2 to 8 grams. And I can tell you right now, if you do that, I'll be getting a million phone calls that you have a head-to-toe rash or diarrhea. So you can't go that high, even if you read about it, because most people can't tolerate it. They'll either get diarrhea or they're literally, we've already seen the pictures that you guys have sent us of head-to-toe rash, and it's from the vitamin C. So think like maybe 1 to 2,000 milligrams a day. If you can get a hold of live on the lipospheric vitamin C, it's pretty much sold out now, but other companies make a liposomal C. It's thought that this has better absorption. If you can't get a hold of this, and thank you, Katie, who is in my practice, for recommending this to me or to us. And we also have seen, ester C as a little more tolerated, gentle and non-acidic. Again, 1 to 2,000 milligrams a day, but if you start getting diarrhea, start getting a rash, you got to stop it, and just when the rash is gone, then you can start having oranges or strawberries, or a fruit that is higher, more tomatoes, something that is going to give you that vitamin C that is going to help your immune system be its most protective. I think that's it for now. If you're enjoying having this little tutorial or this little info session, certainly let me know, because we have the ability to do more of these. My daughter and her boyfriend Joseph, who's a videographer and a editor, is helping me produce this. I can also say, I think probably everybody should have a thermometer at home, so that they can actually validate whether or not they have a fever. And because sometimes we just think we're having a fever, and a lot of our patients who are older may just be having a hot flash. And so it'd be good to know by having a little digital thermometer. Don't have to go crazy, but just having a digital thermometer on hand might be helpful. In closing, I just want to say, be safe, be well. Let us know if there are any topics you'd like to hear about, to cover. I'm thinking about doing one just on my roots. I'm thinking about maybe how to clean your groceries. But I'm also happy to talk about the stuff that we do if somebody's interested. So our email is pastorek, pastorek, @gmail.com. And just send us some messages if this has been valuable, or if there's anything else you want to hear discussed. So we just send our appreciation to all of you, and wish you all the best during these difficult times.